Hello and welcome to OffBlueMedical. Today we'll talk about 5 high-yield emergencies that you have to know for the USMLE. So the first scenario is the paradoxical poisoning that is seen in carbon monoxide poisoning or exposure. So the scenario, you'll see a patient from a poorly ventilated area such as a boat or a garage with headache and nausea. The trap for the USMLE is that there will say that the pulse oximetry is showing 98 to 100% saturation. This is false. The mechanism for this is that carbon monoxide has a 200 times more affinity for hemoglobin than oxygen. The pulse oximetry cannot distinguish carboxyhemoglobin from the normal oxygen levels. So you'll see 98%, it might be way less than that. So the next best step as a gold standard diagnosis is to obtain a serum carboxyhemoglobin assay immediately. And for if the question says immediate treatment, you have to administer 100% supplemental oxygen, and if it's very severe, you can give hyperbaric oxygen therapy. You have to also avoid delay, so you should not order an MRI or wait for symptoms to resolve, because time here is going to be an issue, and the more time that passes, the more tissue will die. The second condition is tearing chest pain, and this is seen in thoracic aortic dissection. So the scenario for the USMLE is you will see a patient that has a sudden onset of tearing or ripping pain radiating to the back. This is sometimes also seen with pancreatitis. Okay, so the pain tearing to the back is sometimes seen with pancreatitis, but here I'm talking about thoracic aortic dissection. So you have to look for pulse deficits or asymmetric blood pressures between limbs. This is surgical emergency, but medical stabilization has to come first. And the next best step for the USMLE is that you have to administer esmolol, which is IV beta blockers to decrease shear stress. And you have to also aggressively control to reach 60 beats per minute and reduce the left ventricular contractility. And you also have to do a surgical referral if it was type A dissections. So if it was the ascending aorta that's damaged, you have to do surgery. But if it's type B, then you can do medical. The other condition is pain out of proportion seen in necrotizing fasciitis. The scenario you'll see on X-ray is gas in the soft tissue. You'll see crepitus, and as signs you'll see fever, hypotension, exquisite pain. The next step here is immediate surgical debridement. You have to do that immediately and then administer antibiotics after that. So you should not wait for antibiotics to work. Start with surgery immediately. The other condition is muffled heart, seen in cardiac tamponade. The scenario you'll see is 3 classic signs. They are collectively known as the Beck triad. The first one is hypotension, and then you have to see distended jugular veins, which is JVD, jugular venous distension, and you have to see distant or muffled heart sounds. So these 3, when you see them in a question, it's cardiac tamponade. You see hypotension, you should not give fluids. Why? Fluids are not enough, because if you give norepinephrine or other vasopressors or fluids, that will not fix the underlying mechanical pressure on the right ventricle caused by the cardiac tamponade. So the next best step here would be emergent pericardiocentesis. We have to relieve the mechanical obstruction on the heart. The other condition is the missing reflex seen in testicular torsion. And the scenario, you will see absent cremasteric reflex on the affected side, and you'll see severe pain in the testicles in an adolescent. Maybe they were playing sports, or maybe it's spontaneous. So the trap for the USMLE is that you have to never order an ultrasound. You don't have to order an ultrasound if the clinical suspicion is high, because delay is going to cause necrosis. And here you will have to do immediate surgical exploration as the next step in management.